Aloha, I'm Dr. Daniel Vickers, President of Discover Chiropractic Hawaii, right here in Kahului, Maui. I've lived on Maui nearly half my life and have been a chiropractor here since 2000. Let's talk about peripheral neuropathy, since that's why you're watching. But first, let me address a question you might have, and that is, why does this chiropractor care about my peripheral neuropathy? The reason I'm so concerned about it is because my dad died of complications stemming from type 2 diabetes. He got pain in his feet, then gangrene in his toe, and they basically started cutting pieces off him until he told them to stop and to just make him comfortable until he died. I don't want that to happen to you, and I'm pretty sure that you and your family don't want that to happen either. So pay attention, because that's a painful and pretty crappy way to die. And one of the early warning symptoms of type 2 diabetes is peripheral neuropathy. The point I'm trying to make here is that I'm a healthcare provider who's going to spend the time and energy necessary to get to the bottom of your condition, whatever it takes. That's my mission. Peripheral neuropathy is often misdiagnosed, or worse, not diagnosed at all. Neuropathy literally means sick nerves. Neuro, pertaining to nerves, pathy, sickness. So neuropathy means sick nerves. This is a major concern because the nervous system controls and regulates all of your body's functions, including all of the internal communication between your various organs and systems and how we interact with the outside environment. Neuropathy can have a positive or negative symptoms. Positive symptoms can be pain, cramping, tingling, or burning sensations. Negative symptoms are more like a loss of function, as in numbness or weakness. Something that should be there isn't. And they can occur together. You can have pain and weakness. Other symptoms can include sharp electric type pain, difficulty sleeping due to discomfort in your feet or legs, pain when walking or standing, which was the first thing my dad noticed, or increased sensitivity from clothing or bedding touching your feet and legs, just to name a few symptoms. Any interference in your nervous system can have far-reaching and harmful consequences for you. Bottom line is that sick nerves equal a sick person. These symptoms are significant components of all neuropathies, regardless of the cause, and all can be helped with our protocols. Diabetes is one well-described cause of neuropathy. Other causes include trauma, chemotherapy from cancer treatment, statin drugs used to lower cholesterol, such as Lipitor, viruses, even genetics. Some causes are presently unknown. They're called idiopathic neuropathies. The symptoms are frequently noted first in the hands or the feet, and they can take on a stocking or glove-like distribution. However, the problem is most likely not just localized to the area where you're feeling it, since neuropathy is often systemic, meaning that it's probably affecting other organs and systems, whether you can feel it or not, and you may not even be aware of this progressive damage. Remember, one of the features of neuropathy is loss of function, not just altered sensation. So one of your body parts can be quietly degenerating until it becomes severe and obvious signs and symptoms start showing up. It's like your car body's quietly rusting away in a spot that you can't see, and one day in traffic, boom, your fender falls off. As you can see, neuropathy can have a lot of factors. It can be complex, and it can be an indicator of a serious underlying problem. As with any chronic condition, it can share some common elements, such as musculoskeletal problems, metabolic disturbances, and of course, neurological dysfunction. These all may manifest in various ways, such as balance, coordination, or weakness issues, fatigue, pain, hormonal imbalances, cognitive deficits, or immune dysregulation, again, just to name a few. All chronic conditions have neurologic and metabolic components, and the key to helping you is identifying all these components by investigating all the appropriate areas with the appropriate tests and then using the appropriate modality for each one, taking care of all of you, the whole person, not just your parts. Doesn't that just make sense? Shouldn't your healthcare make sense? So what is it that makes me different from every other doctor that you've seen? What makes me unique? Well, here in my office, we're going to take care of you structurally, metabolically, and neurologically. Let's talk about the metabolic side. Yes, that means lab work. I know what you're thinking. I've done all the lab work and it's all normal. Well, it's obviously not normal, or you'd be out golfing or surfing right now instead of watching me, right? Or maybe the tests you had done were normal, but they just haven't done the right tests. Neuropathies are not normal, nor are they the result of normal function. One thing I'm going to tell you is that there are lab ranges, which are very broad, and there are optimal or functional ranges, which are more narrow. For instance, it used to be that the lab range for blood sugar went from 70 to 115, and you were considered normal if you fell within that broad range. It has narrowed down a bit since then, but optimal functional range for blood glucose is between 85 and 99. So you could be lab normal and still be outside that optimal functional range. Using these narrower optimal ranges allows us to pick up potential problems before they become critical. They may or may not mean too much by themselves, but they can mean a lot when we see them as part of a comprehensive evaluation. So, for lab work, the first thing we want to do is to get a complete metabolic panel that is going to show us things like your fasting glucose level, sodium and potassium levels, as well as a bunch of other factors that we need to see. We want to look at a lipid panel for fats. We'll do an extended thyroid panel because your thyroid runs your metabolism. We'll run an adrenal stress index, checking cortisol levels. And then we want to look at a complete blood chemistry with autodifferential, separating out the red and white blood cells. It's very important. Why all these tests? Because these tests let us assess how well your organ systems are working. All of these internal functions can be affected when it comes to neuropathy and its underlying causes. It all has to be tested, otherwise we don't know what's actually going on and we'd just be guessing, shooting in the dark. And I don't think you want your health to be a target in the dark. That's why we're going to check just about everything. The next thing we do is food sensitivity testing. Are you sensitive to gluten? That's found in wheat, rye, barley, and some other grains. We check to see if you're sensitive to gluten, milk, and corn, and 22 other different foods. If you're sensitive to any of these things, it could be causing or accelerating your neuropathy. Other food sensitivity symptoms can include chronic pain and fatigue, indigestion, bloating after eating, constipation, diarrhea, or switching back and forth between those two, and sores or ulcers in your mouth. You really need to get the sensitivity testing done. You could also have an autoimmune problem. Your immune system could be attacking your nervous system, so we run an immune panel to find out. There are two parts to your immune system, Th1 and Th2, and the two parts need to be in relative balance. When they're not, you get problems, like neuropathy. We evaluate the balance by measuring certain markers. Poor gut function could be another underlying cause of your neuropathy. If we don't check it, we'll never know and you'll never get all the way better. Your problems could be caused by leaky gut syndrome or by dysbiosis. Leaky gut syndrome is a condition of altered or damaged bowel lining caused by any number of things: antibiotics, toxins, poor diet, parasites, infections, even stress. Dysbiosis is an unhealthy balance between the good and bad bacteria in your gut. Again, you need to be tested or we'll never know. We're going to look at the chemicals that carry messages in your brain, the neurotransmitters. If they're out of range, then your brain can't work right. We also want to look at your markers for inflammation, C-reactive protein and homocysteine, because inflammation anywhere causes problems everywhere. The takeaway message here is that we need to do a lot of testing in order to find the root cause of your problem. Even if you've been told to say type 2 diabetes is the cause of your neuropathy, something else is often driving those symptoms. And furthermore, why do you have diabetes? Is it because you have a metformin deficiency? I think not. So that's the metabolic side. It's what we need to do on the metabolic side in order to get the information necessary for you to get well. Then there's the neurological side. We're going to evaluate you neurologically. Clinical evaluation in my office will show us the neurological pathways that aren't functioning as they should, and these problems can respond very favorably to our brain-based therapeutic protocols. Your brain and nervous system need two things, fuel and activation, in order to survive, to work, and to heal properly. Fuel is glucose and oxygen. Glucose is what your cells use for energy, and it comes from the food you eat, so choose a good diet, and I'll help you with that based on your history and the results of the food sensitivity testing. So that's glucose. Now we want to address oxygen. We can all use a little extra oxygen because as we age, our ability to efficiently use oxygen decreases about 1% per year, past the age of about 30. So we may put you on exercise with oxygen therapy, that is fuel with activation. We get you going with exercise on an upper body ergometer, it's like a bicycle for your arms, while you're breathing in enhanced air. We also use other specific brain-based therapy modalities, such as vibration therapy. Vibration fires up the back part of the spine to the back part of the brain, called the cerebellum, activating numerous sensation pathways. We may also use auditory stimulation, sound in one ear, visual stimulation, lights or patterns or colored glasses, olfactory stimulation, certain smells in either nostril, and heat to increase firing of the brain. Reviewing all the various treatment modalities is really beyond the intent of this modality, but the secret to your success in this program is simple. It's unlike anything you've tried before. It may seem radical, and it is based on sound neurological and metabolic principles that are the basic foundation of chiropractic. And it's safe, effective, and often life-changing. So, now I want you to ask yourself the following 5 questions. And I want you to write these down. Number 1, how has your chronic neuropathy affected your health, your job, relationships, finances, family, hobbies, and other activities? Number 2, what has it cost you in time, money, happiness, and sleep? Number 3, where do you picture yourself in the next 1 to 3 years if you don't take care of this problem soon? Number 4, knowing that most chronic conditions get worse over time, when do you think it would be best to take care of this, now or later? And number 5, what is it worth to you if we could improve your condition? Now, in order to qualify for this care program, there are some certain ground rules. Number 1, you must be 100% committed to getting well. Number 2, you must be prepared to make lifestyle changes, which may be difficult because what you've been doing so far hasn't been working, has it? Number 3, you must take responsibility for your own health. You, not your spouse, your insurance company, or your government, you. Number 4, you must understand that this care is unique and often unconventional, and as such, most of it is not covered by insurance. Therefore, you must be prepared to spend a fair and reasonable amount of your own money as an investment in your health. Here's the real bottom line. If you truly want to get better, you need to do something different from what you've been doing, or you'll continue to get the same results. And apparently, what you've been doing so far hasn't been working very well, and you're ready to make a change, or you wouldn't be watching this video. I can't tell you if you would benefit from this kind of care without an evaluation, and I only accept those who I think will make significant improvement, and I can only accept a limited number of neuropathy patients each month, about 5 or 6. So what's the next step for you? Call my workshop hotline, 873-9221, and leave us a message telling us that you would like a free consultation to see if you would benefit from our program. We'll contact you. We'll send you some history forms to fill out, which you have to fill out completely before you come in, or I won't see you. It's that simple. And we'll set an appointment for your personal free consultation to see if our program is a good choice for you. If you've had recent blood tests within the last 6 months, you can bring those in as well. During this consultation, I'll look over your history forms and your blood work, and if you can get all this to me before your free consult, that's even better. I'll ask you a lot of questions, and we'll determine the next step for you, whether it's a complete exam, more testing, or both. The decision is yours. What do you have to lose? Nothing. What do you have to gain? Everything. No risk for you, no pressure, no obligation. Call us today, 808-873-9221, and request a free consultation. I'm Dr. Daniel Vickers. Mahalo for watching. I look forward to helping you. Aloha.